Charlie Swingle. I'm a physical therapist here at the Recovery Project. What I'm going to be presenting today is part of our low back series. This will be part one of our low back series. This can be performed in a hook lying position, which I'll show you shortly. What you need for this is you just need to find an area where you can lay down flat on your back, or actually with the knees bent, and so that can be either on the floor, on a mat table, or on a firm mattress. So we'll get right into it. So what you're going to start with is you're going to lay on your back with your knees in a bent position here. The first activity that we're going to do is called a posterior pelvic tilt. Now what this is meant to do is to engage our abdominals. So what we're going to be thinking of is taking our belly button and pulling it down towards the floor. So a good trick for this is if you take your hand and feel the small of your back where it kind of feels like it's rounded, what you want to do is you want to flatten that low back into the mat. The key here is not holding your breath. And so what I want you to do is flatten that low back into the mat and feel those abdominals engage. And you can hold for 1, 2, 3, 4, 5, and then go ahead and relax. And then you can go back into it. We'll do 10 of them here. 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5. And again, the main thing here is you want to make sure you're not holding your breath when you're doing this maneuver. So you're taking that belly button and pulling it down towards the mat table here. And as you can see, here at my pelvis, we're getting that posterior tilting and holding 3, 4, 5, 2, 3, 4, 5, 2, 3, 4, 5. And a good goal to start with these is shooting for 3 sets of 10. The next activity we're going to do is called bent knee fallouts. So what these look like is we're going to be in the hook lying position again, knees bent, in a nice comfortable position here. And what we're going to do is we're going to let alternating legs, we're going to have that leg out to the side, nice and controlled, and then back up. You don't have to go all the way to the floor with this maneuver. Go within the range that you feel you're able to tolerate. And back up. And again, we're going to shoot for 3 sets of 10 on each leg here, alternating. Six, 7, and again, this is alternating side to side, nice and controlled. So we don't want to have that leg flopping out to the side. That's very important. 9, 10. And again, as you're moving through these, you may feel that you can go a little bit farther. This is a nice activity to help get the hips moving, which can help take some of the stress off that low back where we're feeling some of that discomfort. 14. 2 more here. And that would be 1 set of 10 on each side. And we're shooting for 3 sets here, 3 sets of 10. Good. The next activity we're going to be doing is called the single knee to chest stretch. What that's going to look like is, again, we can maintain this hook lying position. And what we're going to do is we're going to take one of the knees, whichever side you want to start with here, and we're going to go ahead and start bringing it up towards our chest, towards our armpit here actually. If we bring it right towards the middle of our chest, we might feel a little bit of pinching in the front of that hip. So we can go kind of bring it towards our armpit here and feel a nice stretch. For each of these stretches, you're going to want to hold for about 30 seconds, and we'll go through 3 rounds. If the stretch feels nice and it's something that you're comfortable with, you can even go upwards of 45 seconds here. So you continue to hold. Good. You can use a timer on your phone or anything like that, or do a head count to that 30 seconds. And then you go ahead, and just like we did with the bent knee fallouts, we'll alternate sides here. So I'm bringing that right leg up. And just until I feel a stretch here. Where you want to be feeling the stretch is in that high hamstring, into potentially the glute, and you may even feel it, depending on how much tension you have, into the low back here too. A nice relieving tension stretch there. And again, with stretching, it's not the more pain, the more gain. So this is something where you want to feel a stretch, but you don't want to be pulling so hard or going into ranges where it's painful for you. Something that you can maintain again for that 30 seconds, maybe even up to 45 seconds. And once you get to that 30-second mark, you would go ahead and switch again, and we'd run through 3 sets there total. The next activity we're going to go into is a progression from the single knee to chest activity here. What we're going to do is we're going to go to a double knee to chest stretch. What that's going to look like is pretty much exactly as it sounds here. So, we just did the single knee to chest stretch. So now what we're going to do is we're going to take both of these knees and hug them up towards our chest. Now what you're going to feel is you're going to feel a nice stretch and some relief in that low back there. And this is one that you can hold again for 3 sets to 30 seconds, maybe even up to 45 seconds here. And again, you're just going to kind of relax into that position. Feel the stretch, feel your muscles relaxing, feel some of that tension in the low back letting go. And again, you can use a timer on your phone, or you can do a head count. You're just going to hold this. Good. Following 30 seconds, you can come out of that stretch, give yourself about 20-30 seconds rest, and then work your way back into that stretch for 3 total rounds. Our next activity here is going to be lower trunk rotations. What that's going to look like is we're going to stay in this hook lying position here, and we are going to take our legs. Now we already did bent knee fallouts, so that was one out to the side, and the opposite one out to the side. What this is going to be is we're going to think of our lower extremities here as one unit now. So we're going to nice and controlled here have our legs go to the side and to the other side. Good, so we would consider that 1. We're going to do 3 sets of 10 here. So starting to the left, and then nice and controlled going to the right. Again, what this is doing is it's introducing some rotation into the low back here, some gentle movement into the low back, helping with any tension that we may feel through the low back. And working on our mobility there. So that's 3. Again, we're going to go all the way to 10. And we're looking to try 3 sets. If this is difficult for you, you can change your dosage and go 2 sets of 10 to start, or even 1 set of 10. If 10 feel like they're too much, we can break it up even more, and we can do 3 sets of 5. Again, the importance here is working through the activity nice and controlled. And just like we explained in the bent knee fallouts, we don't want to have this movement be where it's floppy, or we're trying to just take our knees and get them down to the floor. Again, you don't have to get all the way to the floor. If you can, that's fine. But you're just working through this range of motion in a nice controlled manner. feeling kind of that low back loosening up as we're moving through these stretches and some of these mobility activities. We're feeling an increase in mobility, a decrease in tension. Good. And we'll do one more. Alrighty. And that will be one set of our lower trunk rotations. Our next activity that we'll be performing is called a piriformis stretch. The piriformis is a muscle that is located right in the glute area here that is a rotator of the hip. This muscle oftentimes can get kind of tense, tight, and even when you're getting in the stretch, you'll feel a little bit uncomfortable, secondary to some low back pain. So it's an important one for us to stretch to help alleviate some of that tension, some of that pain that we're feeling in the low back. We're going to stay in this hook lying position here, and what we're going to do is we're going to take the leg that we're intending to stretch, and we're going to put it on top of our leg here. If you can't get into that position, I'll show a variation here shortly. But if we can get into this position, what we'll be doing is we'll be taking our opposite hand. So I have my left leg here. I'm going to be taking my right arm, and I'm going to be basically giving a pull from the outside of my leg towards my right shoulder. And where I'll be feeling that stretch is right through the outside of the hip there into the glute. And you can go until you feel a stretch. Again, with our other stretches, we're holding this for 30 seconds up to 45 seconds, and we're going to shoot for 3 rounds. Once you hit that 30 seconds, you would go ahead and switch sides. And you may feel a difference side to side in terms of the tension. And again, that's 30 seconds up to 45 seconds, 3 rounds for each side. Now, if we have trouble getting our leg, the outside of our ankle up onto our opposite leg here, what we can do is we can stay in this hook lying position, and I'll show from both legs here. We can just take that leg up and start to pull across here without having the leg up. Now, we won't get as intense of a stretch in the piriformis, but we still will get a stretch into that area. And maybe after a few rounds of stretching here, we can try to get our leg up onto, or the outside of our ankle up onto the opposite leg here. Okay? So again, what that'll look like is we would just be bringing the knee up, similar to the single knee to chest stretch, but instead of coming up towards our armpit here, we're going towards the opposite shoulder and feeling a stretch in that lateral hip. And if one arm feels too difficult to control, you can bring the other arm along and get that stretch there. Again, we should be feeling the stretch into the lateral hip there. 3 sets, 30 to 45 seconds. That's our piriformis stretch. The next activity we'll be doing is called the cat camel. So what we'll be doing for that is we'll be actually getting into a quadruped position. So we'll get up from the hook lying position here, and we'll get onto all fours. So for this motion, I want to start at the head and then work our way down towards our tailbone here. So what it'll look like is we'll start at the head, so I'll start with the cat portion of this movement. So I'm tucking my chin, and we're going one vertebrae at a time. Rounding my back, pulling my shoulder blades apart here, and get a nice rounding here. Then what I'll do is I'll start down at the low back here for one vertebrae at a time, and I'll start to extend. So we get a rounding of the back, up through the thoracic spine, and into the head, and then we'll reverse it, head to tailbone now. Good. Thinking of trying to move one vertebrae at a time, being very particular with this movement. Good, and we'll shoot for 10 repetitions here. Starting with one set, and as you feel that you can move through more of these, we can increase it. We'll do a few more here. So again, this is camel, and then we're moving into cat. So we'll tuck the chin, round the upper back into the lower back, and then we'll reverse that movement. So we'll start at the tailbone here, low back, extending through the thoracic spine, and into the head, and then we'll reverse it again. Nice and controlled here. And that's the cat camel. So those are the activities for part 1 of our low back series. All of these activities are meant to help improve our mobility and decrease muscle tension. So what we're doing here is we're having some stretches and some different mobility activities at the hips, low back, and throughout the spine that are meant to help relieve some of our low back pain. Thanks for joining us for part 1 of our low back series. Be sure to check back and check out part 2 when you're ready for it. Thanks.